Hello and welcome to From the Floor on our conference channel. Last year, as my team and I walked the exhibit floor at one of the fall conferences, I realized two things. Many health IT professionals could not make it to the conference because of travel restrictions or busy schedules, which is also true right now. And there are many excellent healthcare solutions who were at the conference and they were ready and willing to share their story about how they plan to help propel healthcare forward. We have short conversations with the vendors in their booths, and we ask them to tell us what problem they are trying to solve in healthcare and how they are going about doing that, and hopefully give you a taste of what it's like to walk from booth to booth. We'll try to capture as many of these as we can and share them with you. So we hope that you enjoy the new series. Special thanks to our sponsors on the conference channel, which are SureTest, CDW Healthcare, Artisight, and Rubric, for making this content possible and for investing in our mission to develop the next generation of health leaders. And now, from the floor.
Up first, we have a solution that's been supporting IT for 60 years.
Perfect. So, what is your name and what is your role?
My name is Tanya Johnson. I'm actually the Managing Director of our Health Solutions practice for CTG.
Perfect. And CTG, tell me about them. What solution do you provide for healthcare?
Yeah, so CTG's been around a really long time, over 60 years, started by some fellows from IBM. So we've been in the IT support business for a very long time. Healthcare is our biggest practice, and we've been working in healthcare for about 30 years. Over 900 healthcare organizations we've supported, not just providers, but also life sciences, pharmaceutical companies, medical device organizations as well.
Very cool. So what role at a health system would you like to have a conversation with, and what do you want to talk to them about?
Yeah, we have conversations about all sorts of different things. We really want to listen to what their problems are, find out what solutions that we can provide. We do a lot of work around, there's a lot of talk about transformation, and the world is already digital. So what we want to do is make transformation easier for them, accelerate it for them, be it best practices, really smart people. One of the things I really like about CTG is we're not just supporting healthcare. We do other industries as well. So we're able to bring in all of that knowledge and different technologies from other industries and see how it's applicable in healthcare. I think we provide a lot of value to providers in that we're technology experts, but we also know that healthcare space. We know how doctors work, we know how nurses work, the rad techs work. So we're really in tune with what a clinician does on a day-to-day basis and applying the right technology for them to get their job done in a faster and better and easier way. The other thing that I think we really focus on is patient engagement. We do a ton of work around helping patients access their healthcare in a faster way, in a better way, just providing support for them in multiple different ways throughout their journey so that we always feel like a happy patient makes a happy employee, makes a really thriving provider. And so those are the things that we like to do.
Wonderful. Would you like to let our audience know any success stories or case studies?
Yeah, so we do a lot of work for large organizations across the country. We have stood up statewide COVID lines in order to help them do all of the vaccine management and appointments. So we did that in the course of all of that craziness that was going on in a very short period of time. We work for a lot of organizations, as I mentioned, doing patient support. So really getting out the message, making sure that their satisfaction rates are going up. The STARS program is really going to be more focused on satisfaction of patients coming forward. We've got a little bit of a break over COVID, but that's going to go up to 35%. So we're doing a lot of work to make sure patients are happy and they're staying loyal to their providers because they can choose to go somewhere else these days, and we want them to stay with our clients.
Beautiful. Well, thank you so much.
Thank
and I
you
look
for
forward to
coming
talking
over.
to you again.
We appreciate it. Thanks so much.
Second, we have a solution that helps patients access their care in the health system.
So, who are you and what is your role?
Hi, I'm Scott Dontremont, and I'm the Chief Revenue Officer at Parlance Corporation.
Parlance Corporation. Beautiful. And what is the solution you guys provide for healthcare?
Well, we think it should be easy for patients to reach the health system or IDN and do simple things like change an appointment, navigate to their care provider, and we provide a platform to IDNs that make that a lot easier.
Beautiful. So who at the health system would you like to talk to, and what is the conversation that you want to have with them?
Well, we speak with lots of different people, CIOs and people on their team, but also some of the operators, people that run patient access centers are often our direct customers.
Beautiful. Are there any case studies or success stories you'd like to share with us?
Sure, absolutely. Keck Medicine of USC is one of our big customers. We answer the phone for all of the hospitals there, help their patients navigate, confirm, cancel appointments, and do simple things that make their lives a lot easier. And that's really what it's all about from our perspective. We think that doing simple things should be easy, but we know that it isn't. In a really big, complex organization like a health system, it's really hard to provide that service, which I know is ultimately the mission. We give IDNs those tools that make that a reality.
Beautiful. Well, thank you so much, Scott. It's wonderful to meet you, and we look forward to talking to you more.
Thanks for coming by. Appreciate it.
All right, we'll get back to our show in just a minute. We're excited. We have a great webinar for you in May, on May 4th at 1 o'clock Eastern Time. It is part of our leadership series on modern data strategies in healthcare. In this webinar, we're going to explore data-driven approaches to healthcare and how they can improve patient outcomes, increase efficiency, and reduce costs, which are also critical at this time and this juncture in healthcare. Our expert speakers will explore data governance, analytic strategies, anything that can help healthcare providers gain actionable insights from healthcare data. We would love to have you there, and we're excited about it. You can register on our website. Just hit the leadership series, Modern Data Strategies. It's going to be in the top right-hand corner of our website, thisweekhealth.com. You can discover how we are going to use data to be more efficient, effective in the modern healthcare system. We'd love to have you join us. Again, hit the website, thisweekhealth.com, top right-hand corner. Sign up today. Hope to see you there. Now, back to the show.
Next, we have a solution for personalizing the experience and automating work for the healthcare staff.
So, who are you and what is your role?
Hi, Holly. How are you? It's good to see you. Hi, Bill. Thanks for the opportunity. So my name is James Lakes. I'm the new Chief Revenue Officer for Notable Health.
Beautiful. So what is Notable and what is the solution you provide for healthcare?
So Notable Health, we talk a lot about personalizing the experience, but automating the work. And we personalize the experience for patients and their caregivers, as well as clinicians, administrators, and other staff, all for the goal of optimizing the operational performance and the financial performance for our healthcare providers.
Wonderful. So what role at a health system would you like to talk to, and what's the conversation you want to have?
Well, it varies, right? So we have 5 primary solutions. We have registration and intake, we have prior auths, we have referrals, we have population health, and we have scheduling. So depending on where we are and where we start that solution conversation, it depends on which executives are involved. For example, you can imagine if we're talking about intake and registration, that is a very broad audience that has to be involved in that conversation. It could be the CIO, it could be a cost center executive, it can be a CFO. And so we have to decide where we're going with the solution, what's the most impactful one, to get the outcomes they're looking for, and then we decide on personas. But typically, we're talking to rev cycle leaders, CFOs, CDIOs, CIOs, that type of role.
Wonderful. Are there any case studies, success stories you'd like to share with our audience?
Well, you know, we don't like to brag, but hey, and hi Craig, I'm going to give him a pound here. So, Intermountain Health, we drove some fantastic outcomes with Intermountain Health. So they use us for patient intake and registration. We had a 25% reduction in check-in time for their patients. We had a 96% patient satisfaction rate. We also improved their collections by 300%. And then simultaneously, we had 68% of their patients go through our process, complete the pre-visit registration process. Great improvements, great outcomes for Intermountain.
Beautiful. Well, thank you so much, James. I look forward to talking to you again in the future.
Holly, I will join you anytime. And tell your dad I need to be on the show next time.
Okay. Thank you.
Thank you.
Up last, we have a solution that provides visibility control to your cloud.
Hi, my name is Damian Chung. I work for Netskope, and my role here is the Business Information Security Officer and CSO for healthcare. So what that means is I'm responsible for our corporate security operations, but then I also do our healthcare vertical as well.
Perfect. And Netskope, tell me, what solution do they offer for healthcare?
So Netskope is a cloud security platform, and so what we do is we help customers have visibility to data going into cloud, because now users are going more remote, and their data is going more into the cloud. And so if we sit in the middle of that traffic in the cloud, we can provide better visibility and better granularity and controls to that data.
Yes. Perfect. And then what role at a health system do you want to have a conversation with? And what would you like to talk to them about?
I think really any role within IT or security. So we're not just security specific or IT specific, but within technology in healthcare. I think those individuals who are dealing with data and technology, collaboration of data and trying to secure it, those are people we want to talk to.
Beautiful. And then any use cases or success stories you'd like to share?
Absolutely. So there are a lot of healthcare organizations going to cloud SaaS applications, such as Office 365 or Google Workspaces. And so what we are able to do is provide that visibility control to data going up to those platforms. Now, if you have a lot of data going to your Office 365, you may have different policies versus data going to a personal instance of Office 365. And so we're able to differentiate those instances and apply more granular controls based off the instance and the data that they're using.
That's wonderful. Awesome. Well, thank you so much, and I look forward to talking to you again.
Great. Thanks for coming by.
What a great group of healthcare partners. We want to thank them for spending time with us from the floor and sharing their solutions and their aspirations for supporting healthcare IT. I want to thank them for talking with me, with Holly, and our team from the floor. We also want to thank our sponsors who make this content possible and are investing in our mission to develop the next generation of health leaders. They are SureTest, CDW Healthcare, Artisight, and Rubrik. Thanks for listening. That's all for now.